Okay, it's great to see everybody, and it's lovely to welcome Aimee Grant here tonight to talk about her current research project from menstruation to menopause. Um, I do apologise, Aimee, because I haven't asked you what your pronouns are, so if I said them wrong, I apologise for that. Just let another couple of people in.
I'm happy with a she, her, or a they, them.
Okay, fabulous. Um, just a little word about Autistic Girls Network in case you don't know us well. We are a very tiny charity that supports autistic girls and women and non-binary people, and we do various things. We have a Facebook group. We run various face-to-face groups across England at the moment. We happen to only have them in England at the moment, although one is very close to Wales. Um, and we do some mentoring, we do some adult peer support groups, and we have lots of webinars available on our YouTube channel and lots of website resources. So you're always welcome to join us at any of those things. Right, so now I am just going to hand over to Aimee, and I always think it's better to let people introduce themselves rather than me introduce them, because let's face it, they know themselves much better than I know them. And I know that Aimee is very able to take questions at the end. So what we'll do is we'll have a short presentation and then we'll have questions. And I am going to finish by 8 o'clock tonight because my daughter has only just got home and I haven't seen her, or rather, she hasn't seen me all day. And so she needs to spend some time with me. So we're going to be finished by 8. But I'm going to hand over to you now, Aimee.
Lovely. Thanks, Kathy. So anyone who doesn't know me, my name is Aimee Grant and I'm based at Swansea University. I'm autistic, so I was diagnosed about 5 years ago. And before that, I did lots of research on maternity experiences. And then once I found out that I was autistic, I then had a negative experience of maternity care myself. And that led me into thinking, what do we know about autistic people and maternity? Um, and then I was applying for some funding back in 2021 to do some research, a bigger piece of research on autistic people's experiences of maternity. But then when I asked the autistic community what they'd like to be covered, they said things like, what about endometriosis? What about the menopause? You know, what about significant period pain and all of these other things? So that's how we ended up with the study Autism from Menstruation to Menopause. We're kind of going across the whole life. And so today I'm going to be talking about what we know about autism and menopause. And so before I get into the detail, let me just give you a bit of an overview. Um, I briefly mentioned the Autism from Menstruation to Menopause study, and I'll tell you a little bit more about that in a minute. And then I'll talk to you about how we searched for evidence on autism and menopause before talking through the findings. So what does the research say about autistic people's experiences of menopause? And I'll then give you just some early thoughts on how best to support autistic people during menopause. And they're early thoughts because the analysis of this is still ongoing. So I'm working with a community council and I'm actually meeting them tomorrow morning. So we'll be kind of thinking about these things in a bit more detail and they might change slightly. And then my contact details and the ways you can follow the study will be at the end. And I think Kathy mentioned, but if anybody's got any questions, feel free to pop them in the chat as we're going along, or I'm happy to take them at the end if people prefer to speak. So then, the Autism from Menstruation to Menopause study was developed with the autistic community. And it's got three kind of main sections. So the first is to develop a community council, so a group of autistic people who aren't researchers to help me kind of develop all parts of the project. So we've got 11 autistic people involved doing that with me. And then one of the big parts of the study is an interview study. So we're doing what's called longitudinal interviews. So that means we see people at multiple points in time. So we're going to do up to 10 interviews with 100 autistic people who are assigned female at birth. And we've got 4 different groups. So we've got people, we're calling our young group, who are aged 16 to 21. And then we've got 2 groups aged 22 to 40. So one are people who haven't given birth, and the other are people who have given birth. And then we've got a group of people who are perimenopausal or menopausal and still having menopause symptoms. And then the blue box on the right side of the slide shows we're just trying to keep the public involved. So we've got different social media platforms that I'll tell you about at the end. We're going to be talking to stakeholders, so clinicians have been involved with our research, as well as the autistic community, to try and make sure that the toolkit we develop at the end is going to meet the needs of autistic people. And in the end, we hope it can improve healthcare and make it more accessible for autistic people. But, you know, that's something that is really hard to do when healthcare is so inaccessible at the moment. So one of the things that we're doing right at the beginning is thinking about, what do we already know about autistic people and different parts of reproductive health? So we've already looked at how autistic people experience breastfeeding. Other people have summarised the evidence on autism and pregnancy, and my team have completed a review on periods, and we've got one on puberty that's going on at the moment. That's led by Harriet Axby. And then I'm doing the one on autistic people's experiences of the menopause, and that's what I'm going to talk about in detail tonight. So thinking about how we can find evidence on autism and menopause, we decided to do something called a systematic review. And that just means we search really, really carefully, really systematically. And everything is done by 2 people separately, and then you compare your results. And for anybody who's interested in research methods, we use the Joanna Briggs methodology. Because we knew there wasn't going to be a lot of research, we decided to also include blogs and personal accounts that were available on the internet, that were freely available without a password. So we found 6 research studies and 7 blogs. So we didn't have loads of information, but what we did have was quite high quality. So it was telling us all about menopause and autistic people's experiences, and we thought that the research had been done well. So when you're pulling together all of the information and dividing it out into different areas, you do something that's called coding. So I did that, but I want to make sure that I'm capturing kind of the lived experiences of other autistic adults who've got menopause symptoms or have been through the menopause. So I have 4 people from my community council who are either going through the menopause or have been through the menopause, who are going to be involved in the analysis with me. And so just based on what I've found so far, I've divided the information into 5 key areas. But these are early findings, so they might get shifted around later on. So the first thing was that there were lots of challenges before the menopause. The second is focusing on what people knew about the menopause and how they got information, so using peer support. And I'll speak about each of these in more detail in a minute. The next one is about symptoms and the impact of symptoms. and then getting treatment and healthcare and things that people did to try and reduce their menopause symptoms. And then the last one is intersectionality. So thinking about who gets more impacted by the menopause. So let's start off with the first one of those then. So challenges before the menopause. This was really, really common. So a lot of people in the different studies and the blogs said that actually being autistic in an environment that didn't meet people's needs had meant that life was difficult, and that needing to mask their autistic kind of behavior and communication was really common, and people have been doing it for a long time. And some people had experience of burnout before they got to menopause. Alongside this, we had people with pre-existing health conditions. So these were things like mental health conditions, but also chronic ill health. So, before you even get the wham of menopause, people were already having quite a difficult time. And then on top of it, a lot of people have major life events happening at the same time. So that could be things like childcare, so often children being teenagers and needing quite a lot of support. Relationships with their partner could be quite rocky at this time, and they also might need to support aging parents. And having all of this busyness meant that it could be really difficult for the people in the studies to find time to look after themselves, to prioritize their own self-care, because they were so busy caring for everybody else. So this is what was going on before the menopause. And the next thing I'm going to think about is what people knew about the menopause. So it was really common that people didn't really know much at all. And also, when we think specifically about autistic menopause, there just didn't seem to be much information or resources. So that was among the autistic people themselves, but they also said that their doctors often didn't know anything about it. Sometimes their doctors didn't know much about autism. Um, and people tended to get information online from other autistic people. And this sort of peer support and getting this information from different sources was really valued. But some people did say they were a bit worried about how good the information was that they were getting. Like, was it accurate? Not knowing about the menopause could lead to a lot of confusion and stress and unanswered questions. So, like, one person, when they stopped having regular periods, was absolutely certain that she was pregnant or that she was really unwell, because the menopause had never been spoken about. People talked about the difference between knowing a lot about puberty and even being given booklets and things, but never being given information about the menopause. And so once people started thinking that they might be going through the menopause, or that they were autistic and going through the menopause, they tended to do their own research to try and find out as much as possible. So moving on from what people knew about the menopause, in terms of the symptoms, this was one of the most talked about things in the different studies and in the blogs. And starting with the box on the left-hand side of the screen, symptoms often fluctuated, and that could be really, really difficult to manage. So people said things like they didn't know when their periods were going to happen, so they couldn't plan for that. But also they could be fine for a while and then they'd have a whole week of night sweats, or their mental health could be going up and down, and they just didn't know when that was going to strike. As I mentioned there before, periods and cycle length changed, and it could become unpredictable, but also periods could become heavier and more painful for some autistic people. So we might then be having differences compared to non-autistic menopause. Fatigue and functioning was mentioned a lot. So people talked about being so tired. One person said that, they were just so exhausted that they had no choice but to stop doing things they would normally do. Brain fog, so just like not being able to think as well as usual was very common. One person said that they thought they might have had a neurological disease because it was so severe when they'd coped really well previously. Executive function, being able to juggle multiple things at the same time or do complex things that might have a lot of little tasks in. So, for example, like cooking a meal could become harder. And so people needed new strategies to be able to function. And sometimes that was asking other people for help, particularly partners and family. And that could be really difficult. I mentioned masking earlier, and many people said that it just became either impossible or very, very difficult and energy intensive to mask. So people had to stop masking, but that then kind of had an impact on their relationships with people, on how they saw themselves, and just how they coped socially. Moving on to the box on the right-hand side, sleep was disturbed for a lot of people, and that could also include things like night sweats, and this could interact with anxiety. So if you were woken up in the middle of the night by a night sweat or something similar, and then you were also feeling anxious, that anxiety could then mean that you couldn't get back to sleep. The sensory kind of challenges of being autistic also seem to be increased during menopause. Um, and that could be like existing things getting more extreme. So, like a sensory difficulty with light or noise could increase, and it could be like a smaller thing would be difficult, more difficult to manage. But some people got new sensory sensitivities. So, food was talked about. So, safe foods stopped being safe. And this had a lot of impacts for people. It could really impact on their mood, the way that they could communicate, because the sensory could be so intensely distracting, and their relationships if it just wasn't understood by others. Unsurprisingly, mental health and coping came up a lot. So some people already had kind of struggled with anxiety or depression earlier in their life, and it could get worse. For some people, it was completely new, and some people had really severe meltdowns, and meltdowns that were more frequent than they were used to. So it could be really, really difficult to manage. We had a few people also talking about things like changes to their appearance, like developing facial hair, their body hair and hair on their head changing, and then things like hot flushes and urogenital changes. So strugglings around like urination and sex. They were mentioned a little bit, but not as much as I might have expected. And do feel free to add things in the chat if you're thinking, I'm surprised that this thing isn't there. Do feel free to pop it in the chat. So thinking now about the impact of these symptoms, the change and lack of control that people felt in their life was really, really difficult for a lot of people to manage. And I think this was definitely related to being autistic and the familiar and stability being very comforting for us. As I mentioned before, meltdowns could just become more extreme. So there were some people who were kind of injuring themselves or more frequent. And also, kind of the threshold to have a meltdown could get lower. So things people could have coped with previously were now just sending them over the edge into a meltdown. When when people were talking about how they felt about the menopause, people before they knew that they were going through the menopause, or if they suspected they were going through the menopause but they didn't yet know they were autistic, could be really quite self-critical. They could blame themselves. They could say, oh, I should be eating better, or I should be coping better with this thing. But actually, once they knew that they were going through the menopause and they were autistic, people tended to be more compassionate. So actually knowing that you were autistic was quite important to people being able to be kind to themselves. And some people did seek diagnosis or start to self-identify as autistic because of the menopause making being autistic so much more challenging for them. Other people talked about feeling like they needed to hide their symptoms, that, quite a lot of symptoms of menopause are quite taboo, so they didn't want to tell other people about them. And relationships could be impacted. And this was family, friends, and romantic relationships. And we just had a whole lot of changes there. Also, as well, work could become much harder. So, one person talked about being autistic really working for them previously, that they were doing really well in their job. It used all of their skills as an autistic person, but actually, menopause just kind of created chaos for them, and they just weren't able to work at that level anymore. Not being able to mask at work could also mean that things got more difficult there, and some people ended up changing careers, but that could then mean moving into lower paid work, which is obviously difficult. So then thinking about treatment or responses to the menopause. So the first thing that most people did was a level of self-care. So some people talked about resting. So they actually previously they would have pushed on through until they were completely exhausted, but now they had no choice. They had to rest, or the periods of kind of burnout, the downtime they needed just got longer and longer. Other people talked about kind of nourishing exercise, so things like yoga, going for walks in nature, and some people talked about changing their diet and alcohol. Three people mentioned taking non-prescription supplements, um, and there were there wasn't really a lot of information about that and how helpful it was. Some people talked about seeking healthcare. So one person talked about having two really difficult social interactions that led her to going, actually, I need to get some help with this. This isn't normal for me. But generally, people didn't talk about why they sought healthcare. So I think it was probably just that their symptoms have got so severe. But the experiences of healthcare were really quite negative. So a lot of people said they decided they weren't even going to try because it's so difficult to get an appointment. You need to phone, there's a long waiting list, or they've had previous negative experiences of healthcare. And those who did go and ask about menopause symptoms said that doctors often had out of date knowledge about menopause. And it could mean that they would say things like, oh, yes, we don't prescribe HRT for very long, or you don't need to have HRT, when the evidence has really moved on. There were very few good experiences. So one person talked about their GP writing notes for them about what had been discussed so they could take it away to help them remember it, and routinely giving them a longer appointment. But there were many more bad experiences. Like one person talked about needing to take information with them, so printing information off and taking it, because otherwise they just get dismissed. But then the doctor's not liking that they're taking that kind of leading role in the consultation. And so then when it came to HRT, so taking like estrogen or progesterone supplements, which is kind of like the gold standard care for menopause, there was really limited evidence in our review. So we had four sources out of our, was it 11, 13? Sorry, I'm not so good later in the day, but we only had four sources where people talked about taking HRT, and that wasn't everybody. Um, And so some people had asked their doctors and not been able to get it. Some people felt reluctant to take it because they either generally were distrustful of medicine and seeing doctors, or they wanted a natural menopause. But we didn't have much information about what taking HRT was like. One person said they came off it because of side effects, but I think we really need to know more about how autistic people experience HRT. So if anyone's got any experiences of HRT, good or bad, do feel free to pop them in the chat, because I think that might be helpful for lots of people here who might have questions as well. And then the last thing that we found then was a small number of mentions. So we just had 2 papers where they talked about intersectionality. So that's how not being cisgendered and white and well educated and a high income, those sorts of things could make it extra difficult to be autistic and going through the menopause. And so in one study, there was a trans man who said, you know, it's so much harder to talk about the menopause when you're a trans man. And another talked about the financial insecurity and being on a lower income, maybe needing to like change jobs and have a lower income could make it even harder, because then people can't afford to do these self-care things that might be valuable for them. So that's a summary of where we're up to in the findings at the moment. And again, as I mentioned in the beginning, this might change a bit. So I've still got my community council involved before we write this up. But just some early thoughts of how we can meet the needs of autistic people during the menopause. And these aren't really, some of them are from the research and some of them are kind of me stretching an interpretation. So I think we need to make society more neurodiversity affirming, and that will reduce the challenges that autistic people are facing before the menopause. We also need to increase societal knowledge of menopause. You know, it's ridiculous that in this day and age, there are people that don't know they're going through the menopause when they start to get symptoms. We also need to increase knowledge specifically on autism and menopause and how it might impact us differently. So those changes in sensory, those big changes around mental health, you know, the changes with relationships and things, knowing that might be about to happen could mean that people could put some safety nets around themselves. So we need clinicians to have that so they can pass it on, but we also need it in the community, and peer support might be useful. So we don't have evidence to say it definitely is, but at the moment it seems to be the only thing available. And I also think we need to think about the impacts of intersectionality. So a lot of this autism research is being done on white, highly educated women who have got a high income, and they're going to have quite different experiences to people who are more underserved in the autistic community. So that was everything I was going to talk through today. And so I've just got the contact details for the study website, Instagram, TikTok, YouTube, Facebook, and my email are here on the slides. So yes, please do follow the study. We've got a mailing list that you can sign up to on our website on the Contact Us page. And I'm really happy to take any questions. And maybe I'll leave this up in case people want to take screenshots or copy anything down.
Thanks, Amy. That was fascinating. As somebody who is menopausal themselves, yeah, a lot of negative experiences there. And I have to say, I don't think I've had any positive experiences of being menopausal, unless I'm not sure if it's being menopausal or getting older. I think getting older does have a positive slant in that you just don't care what people think. But I'm not sure that that's I'm not sure that can be correlated to menopause, sadly. Otherwise, we could count it as a positive, couldn't we? Okay. So I was quite struck by one of the slides, one of the early ones, which was talking about menopause symptoms, because I think many of those would come up for a 14-year-old starting their periods as well, or a 13-year-old, or a
Ooh,
12-year-old, or even a 9-year-old starting their periods. We're talking about the same kind of thing, aren't we? We're talking about the same huge kind of sensory explosion.
yes.
We're talking about, you know, a different experience of pain. We're talking about that transition period, which is always going to be difficult. There's a lot of parallels, aren't there?
I think there are, and so as I mentioned earlier, Harriet Axby is doing a review of puberty as part of this study, and yeah, we've definitely got the similarities to the huge hormonal differences. Um, I think the differences that we have are that people are kind of expecting puberty, but they're not really expecting menopause.
Which is odd. But yes,
Yes.
I agree. Yes, yes. And I mean, there's also, you know, the whole, obviously, there is such an overlap and such a huge number of co-occurring conditions with autism, but ADHD is one of the biggest ones. And I think there's a huge impact on ADHDers as well going through menopause.
Yes, I would say so. Um, I I mean, I'm talking from kind of the experiences of friends, but yeah, I think you know in the review of the existing research on autism, it led quite a lot of people to get diagnosed. And it might be that it might lead ADHDers to get diagnosed, or if they're already diagnosed, to maybe seek medication. It did seem from our review, and of course, we don't know how many of these autistic people were also ADHDers. Um, you know, that things like having 36 tabs open on your computer at once actually previously was fine, but it became more difficult, one person said. So, like, you know, those sorts of things that might work well for ADHDers might stop working so well during menopause.
Only 36. Lightweights. Okay. Right. Let's have a look at the some of the comments in or questions in the chat. Somebody says, is 40 the eldest participant in your research?
No, so we've got four groups in our research. So we've got one that's 16 to 22, two groups that are 22 to 40, and then our group of people in perimenopause and kind of having menopausal symptoms are of any age as long as they're over 16. So yeah, we're not stopping at 40 for our menopause group.
Okay. Louise says it would be interesting to see if there's a difference between those who were diagnosed earlier in their life compared to those who were diagnosed around perimenopause.
Absolutely. I think one of the things that kind of fits between the different themes that I've presented tonight is that not being diagnosed meant that people were really hard on themselves. They didn't know what was wrong. Um, some people went to the doctors and they got other diagnoses, which then, when they reflected, when they later either self-identified or were diagnosed as autistic, they just went, oh yeah, actually that diagnosis was completely wrong. It was autism and the menopause together. So I think, yeah, that's something that would be really interesting to look at.
Definitely. Somebody says, I'm curious as to whether any positive changes were mentioned or asked about.
So thinking about the positives, there weren't a lot. So many people said that they were really looking forward to the end of their periods. Um, some people said the kind of the unmasking that they did around menopause was like good for them and their mental health. But generally, I think it was just a really hard time.
Mm, yeah, I agree. Okay. Somebody says any variability between HSN versus LSN. medicalized terms. I
Oh,
presume that
I
means
don't
high
know
support
what.
needs. I presume it means high support needs versus low support needs.
I don't know if any of the studies actually managed to get anybody with high support needs in them. So we had a couple of surveys and 4 interview studies, and I think they were mostly highly educated white women who were taking part. So I don't think we've got good information there. So currently, in my study, we're having 100 autistic people that are kind of at various points on the life course, and we are still looking for some higher support needs, so people with learning disabilities, for our menopause group. I don't know if it's okay to ask here, Kathy, but
Ask away.
yeah. So if anyone fits into that group of having a learning disability, so by that, I don't mean having dyslexia, I mean like a learning disability that they would call an intellectual disability in America. So that used to be, they would say that your IQ, I think, was below about 75, but they've moved away from that definition now. But we would like to get some more people with learning disabilities into our study. So do email me if you're autistic, going through the menopause, have learning disabilities, and you live in the UK, because we'd like to get that representation when we can. Unfortunately, autistic people with learning disabilities die 31 years earlier than the general population. So, it is going to be a smaller group. And I do wonder if people with higher support needs who might have a learning disabilities diagnosis might not also get an autism diagnosis, because if you've got one diagnosis, sometimes that's seen as like enough. So I think it is going to be harder to get evidence for that group.
Much needed though, so that we can figure out why the mortality rate is so high. Okay, so
Definitely.
we've now got quite a few comments about HRT. So Louise says HRT has been a game changer, life changing on multiple levels. She's perimenopausal and has been since she was approximately 38 years old. Sylvia says, I take HRT and have felt a huge improvement. My menopause symptoms have almost disappeared. Yeah, I think I need to go to the doctor. I've been avoiding it. Kim says, I'm on HRT, early menopause at 38. I've been taking it for 18 months and have found it had a positive effect on the worst of my symptoms. Kendra says, my doctor isn't taking me seriously. I'm 40 and got a lot of symptoms. Hot flush is really bad. Early menopause runs in the family at 39. Elizabeth said, I started HRT. A few months later, after weird periods, I was diagnosed with an ovarian cyst and had to stop the HRT. The cyst went away by itself, but nobody told me what to do next. I'm so tired of the doctors and I haven't gone back, but I think I need something. Yeah, I think you'll have to go back, Elizabeth.
Yeah, I think I should probably say here where I am. So I can't remember if I said it at the beginning, but I'm perimenopausal. And I'm only 42. I think I've had symptoms quite severely for about 4 years. My mum also had an early menopause, and I went to my GP 3 times over 3 years to ask for some HRT. In a previous job, I worked in a medical school, and that involved teaching doctors. My title is doctor. I've got a lot of privilege, and I wasn't able to convince them to give me any HRT. And I did a talk about the autistic menopause, and there was a doctor who specialised in the menopause there who said, come to my private clinic, I'll give you a free appointment. And I had quite severe symptoms. I got HRT from doing that, and then had some follow-up appointments. But all in all, I probably spent, even with that free initial appointment, I probably spent over £1,000 before I then had managed to get myself in a position that I felt ready to approach a third GP at my practice, because I didn't want to go back to the two that had already said no. One had said no twice. So I wanted to go in and be like, look, I've had this, it's going really well. I've had a blood test, they're happy with all of my levels. Will you continue prescribing it? But it's ridiculous that you have to do that. I think, yeah, looking at Kendra's comments, I'm really sorry. Like I had, there's a type of cystitis where you don't get a burning, but you have a constant feeling like you need to go for a wee. And I had that for 3 years constantly, and I got HRT and it immediately stopped. And it just makes so much difference to your life, as well as the hot flushes and everything. I've actually felt cold this year for the first time in several years. I've been like, oh, it's cold this evening, whereas I've just been roasting for several years before. So like Kim and Sylvia and Louise, it's made a massive difference to me. I've got more energy. I've found it really positive. But I'm completely with you, Kendra, that it's so difficult to get your GP to pay attention. Like
which is
if I can't
not
do
how
it
it
with
should
all of
be, is
my
it?
privilege, it's going to be even worse for anyone else who doesn't have those kind of like experiences of working in healthcare.
Yeah, and I wonder, I mean, there's been issues with the provision of HRT, hasn't there? Just like ADHD meds. And we are increasingly seeing in our Facebook group um, GPs refusing shared care for ADHD meds. And it does make me wonder whether HRT is going to be going the same route. Guess
I
we have to wait and see.
As part of this other menopause talk I did, there was an MP who's very, very pro HRT, and she did say they will be prizing my HRT out of my cold, dead hands. And that is definitely how I feel about it, that, they allow men to have Viagra. If they're going to let men have Viagra for something that impacts them for a small amount of their life, where menopause impacts everything to do with our body, it impacts our bone strength and all sorts of things, then, I think there will be, marches in the streets of all the people whose lives are so much better with it.
Yes, yes, and don't mess with a menopausal woman, I say.
Yes.
Okay. Right. Steph says she's been under the menopause clinic for the last year. After 2 years of HRT, all her symptoms returned, and then everything was rehydrated. I can't say that tonight. Early days on HRT really helped with joint pain. Oh, that's interesting.
Mm. I've
Okay.
heard from quite a lot of people that GPs will only prescribe the minimum dose of HRT. And yeah, like having that then kind of increased up to a level where it's stopping your symptoms is really important. Again, thinking about Viagra, if it doesn't work, they give you a higher dose. Why won't they do it
Yeah.
with HRT?
It's
And they,
problematic, isn't it? Do we need specialists? Should we be doing this at the GP? Should we be going to a specialist who's a real expert on this? But then again, how do we get access to a specialist? It's
yeah.
hard, isn't it? Okay. Right. Sylvia asks, is early menopause related to being autistic?
I don't think there's any evidence so far. So in our review, there were only 2 studies, and neither of them found that earlier menopause was normal for autistic people compared to non-autistic people. So they both had autistic and non-autistic people, but they were both quite small groups of participants. When we think about puberty, there's more evidence, but actually there's some evidence for early puberty and there's some evidence for late puberty. So it might be, like sometimes autistic people are like at one extreme or the other, and like maybe we're not in the middle. But we don't have good evidence at the moment, but I think it would be interesting to know.
Yeah, I would be interested there. Hannah says, I'm a clinical psychologist and not had one session on the menopause, let alone how it impacts us as autistic people during my training. Absolutely ridiculous. Yes, it is, Hannah. It really is.
I
Um,
completely agree.
yes, I agree too. Uh, executive functioning skills take a beating with menopausal autistic women. Yes, and ADHD women, although often that is the same person. um, Elizabeth says HRT is a game changer for me, but had real trouble getting the right balance of hormones. Yes, and
Mm,
there was some controversy earlier this year, wasn't there, with a doctor who was making high doses of
yes,
various things, and
high
that's always
doses of estrogen and not enough
mm,
progesterone, which so if you're taking estrogen as HRT, you have to take progesterone as well. And that protects the lining of your womb, of your uterus, because otherwise you're more likely to get cancer of your uterus. So yeah, it's interesting, that thing about being quite sensitive to hormone changes. I I feel like anecdotally that's probably going to be more true for us, but I don't know if there's any evidence of it kind of generally. I think it's something to look
there seems to be
into.
so little evidence on menopause at all. So okay, Andrea says I have HRT patches, and hadn't quite got the balance nailed yet, but they do help. Not a magic wand though. Sorry, that's my spaniel if you can hear her. Um, right, what have we got? I'm hypermobile and my joint pain until I had HRT was unbearable.
Uh,
Yes.
and that's really relevant. So Jessica Eccles, who's based at Brighton, does research on hypermobility and how it fits with being autistic. Um, and so many autistic people are hypermobile. My pain has definitely gone down with HRT.
That's interesting, isn't it? Um, Hannah says, I found it's more my ADHD symptoms that have been affected. Until now, I've felt autistic with a little bit of ADHD. That was actually freakily helpful, whereas now I feel full-blown ADHD and not in a helpful way.
Mm.
Yes, I can relate to that very much so. And Chantal says, I was diagnosed with ADHD in perimenopause at age 49, autism at age 33. HRT has not been successful so far. I'm sorry to hear that. Okay. Um, I'm just trying to see. Elizabeth said, I haven't had periods for about 8 months. That's been fantastic. Yes, I can relate to that too.
I'm looking forward to that.
You have to take the right pill and then you don't have them for years. That's the right thing to do. Uh,
Oh, the person who says they're doing a qualitative
what
study looking at the effects of the menstrual cycle on autistic and ADHD people, you've come up as a series of letters and numbers. Would you like to email me? I think it would be great to find out more.
yes, that would. Um, Julie says, I do occupational therapy in Nova Scotia and would love if you can share any information on autistic women and pregnancy or breastfeeding.
Julie, why don't you drop me an email and I can send you a bundle of resources? We've got a series of videos made by autistic parents and also autistic lactation consultants. So yeah, lots of stuff there that I can send to you.
That sounds good. Carla says, how long do people suffer symptoms before looking at HRT? My hot flushes seem to come in bouts lasting a few weeks, then go away for a while when I'm just thinking about looking into treatment. It's
Mm.
trying to trick you, Carla.
It wasn't clear in the research. Like most people didn't seem to. But yeah, I think I was probably having symptoms for at least a year before I tried asking the doctor.
Louise says she was gaslit for years. It seems to be a bit of a recurring theme, doesn't it? And the needs for self-advocacy are huge and very demanding,
Mm.
which is pretty typical, I think.
They're
Um,
completely exhausting.
Julie says, any information on why autistic women experience significant pre and perimenopausal symptoms much earlier than when periods actually stop or blood tests show it?
We don't have any information on the kind of the why at the moment. We do know that autistic people who have depression are more likely to have higher menopausal scores. I would argue that autistic people with depression probably have an environment that's more difficult to manage in for a lot of them. So yeah, we don't have great information there, unfortunately.
Someone has recommended a book that's quite positive about menopause. I might read that too. Listen to
Mm.
Making Sense of Menopause. Oh no, sorry. Listen to was it on Audible? Making Sense of Menopause was the name of the book. Uh, in my in my many hours of spare time, I might try and read that.
Y
Um, could, could my hot flushes be worse because I got told that autistic people find it hard to regulate body temperature?
I think definitely, it's something that I'm aware of myself. Temperature was mentioned a little bit in the research, but not loads.
Okay. Someone says, just curious, is there anywhere online I can find a childless autistic menopausal group? I don't mind kids, but I have to scan just one too many raising children related comments in my mixed group online. Any knowledge about that?
I don't think there's anything I can share. There is a Facebook group, but I've been asked not to mention it in talks previously.
Okay. Um, Julie says, can you put your email in the chat? I'm not sure if that's for you, Amy, or for somebody else.
Oh, let me drop it in there.
Sorry, I'm still working my way through the chat. Donna says, I'm a learning disability nurse. We are trying to work with various networks to develop resources for our patient group experiencing the menopause. That might be a nice link, Amy.
Definitely. That sounds really good.
Donna, email Amy. That's the way to go. Caris says, I battled with my GP for many months to get HRT. And she's only been on it since September and hasn't noticed any side effects, good or bad. I guess that's not good that there's not been any change. Okay.
They
Uh,
tend to say that if you're, I don't know if it might be difficult because of the risk of breast cancer in your family, but they tend to say if you're still symptomatic that the estrogen level needs to increase. So I'm taking the gel that you rub onto your legs, and I started at 2 pumps a day, and I'm now up to 4 a day, which I think is kind of a reasonably standard level.
yeah, so it might be one to go back to the doctor about.
Yeah,
Okay.
definitely.
I was going to ask you, Amy, whether whether we could talk quickly about the new changes to menopause at work kind of changes. And
Mm,
obviously, with menopause now being recognized as a disability, and which employers have to make reasonable adjustments for. I wondered
mm.
if you'd heard of any changes or any fantastic reasonable adjustments that you'd heard about, or maybe someone in the chat might have had a reasonable adjustment at work.
Mm. So I know at Swansea University, where I'm based, we have a menopause cafe, and there are a group of, presumably we're all menopausal, um, people who are just trying to think about making the university more menopause friendly. So I suspect that there will be little pockets of practice going on. My experience as someone who's disabled, so I'm a wheelchair user as well as being autistic, and I've got all sorts of other health stuff going on, um, is that it very much depends on your line manager for getting disability reasonable adjustments. And I think it will depend on your line manager for getting menopause adjustments. And we know that men tend to be more represented in higher levels. So, if managers are men, are people going to feel comfortable going to them and asking for those adjustments? Having to describe some quite personal symptoms sometimes. I don't know. Um,
Yeah, I agree. Um, okay. Oh, I just saw a question and now it's disappeared. Where's it gone? Uh, Kirsty says, is there any information or sources you can share about side effects of hormonal contraceptives and their effects? My autistic daughter has been prescribed this to manage heavy periods, but I'm almost sure her depression and fatigue is a side effect of this. What was the name of your colleague working on puberty and autism?
So I don't think we have found anything about hormonal contraception and how it impacts autistic people. Um, but feel free to email me and I can put you in touch with Harriet. And I can also check. So I've got 4 lovely autistic researchers working for me, and Rebecca Ellis has been looking into contraception. So if you drop me an email, if there is anything, I can send you on a copy of the paper.
Okay, right. So this is probably going to be the last 1 or 2 questions. Claire says, suggested reasonable adjustments: desk near a window or air conditioning unit or fan or toilet, well-being room, protected break time, permission to leave the building for a walk when you need time out. They sound good. Caris said, I battled months to get HRT. Oh no, I've already read that one, haven't I? Sorry, Caris. I think it was the reply coming up that brought that up. Okay, let me find the last ones. More reasonable adjustments. Impacted by diary needs. My brain is showing that as dairy, and I don't think I don't think it's dairy needs. Where I needed longer to get in, that was okay. Elizabeth says, I have a workplace passport that helps me. I have daily one-to-ones with my manager, limited visits to the office, authority to delegate when I'm having trouble multitasking, can finish early if I'm not feeling well. My manager is male, but pretty unflappable. That sounds good.
He sounds awesome.
Yeah,
Hold
he
on to
does.
him.
Yes. Right. I think there's nothing new in the oh, hang on. Oh, he is awesome. Good. Good. I'm glad to hear it. Okay, so I'm going to wind up now because we're almost at 8 o'clock. I'm going to give you back 2 minutes of your life, so that's always good. And thank you so much for coming tonight, and thank you, Aimee, for coming along and talking us through. It will be really interesting to see what happens. When is the study finishing?
So this review hopefully will be sort of published in the next year, and then the interview study is going to go on for another 4 or 5 years at least. So we've still got a lot to go, but we will be, sharing findings as we go along, and we'll be very happy to come back and talk to you.
Yeah, and it will be so great to get some longitudinal data on this, because
Yeah,
there's so little data anyway, isn't there? But getting the longitudinal stuff is extra hard, of course.
definitely.
Okay, well, thank you ever so much, and have a good night, everybody, and I will see you at the next webinar.
Thanks, everyone.
Bye.
Bye.